many people around the world who lack the most basic healthcare provision. Many of these people live in poor and remote communities that have little or no access to medical services and as a result are suffering and even dying from common and treatable illnesses. High mortality rates and the suffering caused by these ailments could easily be combated by some basic but regular medical attention. The Amazon Hope Medical and Dental Program was established with our partners Scripture and Union Peru to confront these healthcare issues in the Amazon. The Trust First medical ship, Amazon Hope, went in search of those most in need of access to medical care. Today, our two ships reach over 100,000 people in remote communities inaccessible by land every year. The medical ships travel to their patients who would otherwise have days canoe or boat ride to Iquitos for a single consultation. The Amazon Hope ships are able to travel down some of the Amazon's shallowest tributaries, being able to reach the most remote villages and even some tribes. These floating clinics are run by a team of full-time Peruvian medical and technical staff who are supported by UK volunteer clinicians who join them for a 2-week working holiday trip to the Amazon. The Peruvian medical staff consists of 3 nurses, 3 doctors, one of them the director, and 1 dentist, also the trip coordinator. The number of volunteers varies from trip to trip. Generally, volunteers are nurses, GPs, dentists, and dental nurses. In some occasions, volunteer ophthalmologists go on board and perform cataract operations in various communities. A couple of translators are usually present during the trip to provide communication support to the non-Spanish speaking doctors. The Amazon Hope 2 ship consists of 3 levels. The lower deck contains all the health-related facilities. 2 operation rooms, one of them divided in 2 during checkup periods, 1 dental surgery, a pharmacy, and a waiting area. Each room is supplied with all the basic and necessary tools towards patient's treatment. The middle deck contains all the bedrooms. It consists of 4 cabins at the stern and 6 at the bow. Each cabin contains 2 bunk beds and a set of cupboards. The open area in between the cabins is used as a waiting area when the ship receives great numbers of patients. The upper deck is an open air space used for dining. It is also the registering and waiting area for patients, and it is where community members are taught basic health habits. A regular day in the Amazon Hope consists of an early devotional time organized by the Peruvian crew to which everyone is welcome to join. By then, the ship would have already reached the first community out of the 2 that are held per day. Breakfast is served at 8 a.m. and at 9 a.m. community members are welcomed on board. Before consultations begin, doctors are given the opportunity to explore the visited community. After that, attention to patients begin. Work goes non-stop until midday, and if needed, consultations continue after lunchtime in that community. Otherwise, the Amazon Hope will continue its journey to the next community. Attention at the second community starts at 3 p.m. and usually ends at 5:30 p.m., depending on the number of patients received. The Amazon Hope provides a primary healthcare service and deals with medical conditions such as anemia, arthritis, chest infections, chronic pain, diabetes, and skin infections. Doctors can prescribe various medications and vitamins to their patients, which will be provided to them by the Amazon Hope's pharmacy free of charge. Additionally, the Amazon Hope's dental health aid carries out teeth extractions and fillings.
Absolutely amazing. The team was brilliant. All the work was just fantastic. You felt like you were really making a difference.
Everybody was very friendly and helpful on the boat. The translators were really good. We enjoyed the mix of medical conditions that we saw, felt that medically speaking we were kept on our toes all the time.
It was really good for us because it built up a lot of experience, especially in the extraction and oral surgery side of it, where back home we don't really get that much experience. So for Carlos to teach us all his wisdom, so to speak, was really good.
We welcome all volunteer clinicians who wish to join our Peruvian medical staff on a 2-week excursion on board our medical ships, Amazon Hope or Amazon Hope 2. Visit us online for further details at www.vinetrust.org.